Hi, I'm Sandy French, nurse practitioner with Vein Care Centers of Tennessee. Today I want to talk briefly about a commonly overlooked cause of chronic pelvic pain in women called pelvic venous disease. Pelvic venous disease is a term used to describe insufficiency or obstruction of the pelvic veins. Dr. Stephen Doherty, an expert in the treatment of vein disorders, will go into further detail on the anatomy and underlying pathophysiology involved with pelvic venous disease and some of the causes of chronic pelvic pain. But first I want to touch on some of the common symptoms and historical findings associated with pelvic venous disease. Chronic pelvic pain is pain greater than 6 months and not exclusively associated with the menstrual cycle. When chronic pelvic pain is associated with pelvic venous disease, women will often complain of a chronic pain of the lower abdomen or pelvic area. This pain is often described as a dull, chronic aching, throbbing, burning, or inflamed feeling, or a deep, sharp, stabbing-like pain. Women may also experience pain into one or both legs with aching, heaviness, throbbing, and/or swelling. The pain may be intermittent or daily and is often exacerbated by standing or sitting for extended periods, walking or exercise, intercourse, the menstrual cycle, and pregnancy. The pain will often improve when lying down because this reduces the pressure in the veins. Some possible physical exam findings associated with pelvic venous disease include the presence of bulging varicose veins of the lower abdomen, pelvic or labial area, upper inner thighs or posterior inner thighs or the back of the upper inner thigh. However, pelvic venous disease can be present in the absence of these physical findings. Signs of a possible obstruction of the pelvic veins may include sudden onset leg pain and swelling, often in one leg, in the absence of deep vein thrombosis or blood clot found in the leg, or in the presence of an extensive blood clot of the thigh area that extends into the pelvic veins. For women who have been evaluated for pelvic pain with no findings to explain the pain, or who have been treated for other conditions but continue to have pelvic pain, then it is worth taking the next step and being evaluated for pelvic venous disease.
Hello, I'm Dr. Stephen Doherty. You've heard from Sandy about some of the symptoms you may have if you have chronic pelvic pain. Well, chronic pelvic pain is a really important problem out there in our world because it causes so much disability for people. It interferes with their lives. Sandy's an expert on diagnosing chronic pelvic pain and on sorting out some of the problems that cause it. In fact, Sandy recently published an article in the Journal of Nursing Practice regarding how to recognize patients with chronic pelvic pain that might be due to venous disorders. We've also published on the same subject, but in treating chronic pelvic pain due to venous disorders. In fact, we were the first entity to publish in a medical journal a study of patients who had chronic pelvic pain due to compression of veins in the pelvis affecting pelvic symptoms and leg symptoms both. So I want to review with you some of the anatomy behind some of this. This will not be highly detailed, but it will give you an understanding of what we're sorting out as we evaluate these things. You can have chronic pelvic pain for a lot of reasons. There can be problems with the uterus down low in the pelvis that can cause pain. Sometimes that lasts a long time. Fibroids, which form on the uterus, are one of the more common causes of that. The ovaries live on either side of the uterus. The ovaries can cause pain too. You can get a cyst on an ovary which stretches. It's a fluid-filled cyst and it stretches and it can cause pain. Sometimes the cyst will rupture and bleed a little bit into the pelvis, causing pain. But those typically last a few weeks to a few months. Chronic pelvic pain is defined as pain that lasts more than 6 months in the pelvis. And so we're looking at things where the pain just doesn't go away, or it doesn't go away for very long a time. There are other causes of chronic pelvic pain that are gynecologic in nature. We've talked about the uterus and the ovary. There's something called endometriosis, which is the cells that line the uterus can actually escape the uterus and wind up in some of the other tissues, causing pain that usually is worse when the menstrual period is developing and then goes away. Endometriosis is a real entity, but it sometimes gets blamed when it's really not the problem or not present, just because the source of the pain is not readily obvious. Some patients will have what we call pelvic inflammatory disease, which is an infection in the pelvis. That typically is not confused with chronic pelvic pain. That's severe pain that comes on and that responds to antibiotics. there is pain that's called pudendal neuralgia. There are nerves down deep in the pelvis that extend down around the floor of the pelvis, down around the labia and the muscles just above the labia. And you can have pain down there from problems with some of those nerves. In practice, though, that's pain that's very, very low down near the lower part of the pelvis and is not really confused easily with chronic pelvic pain higher up in the pelvis. Sometimes people have both. Pain at the vagina, in the lower part of the vagina, in postmenopausal women usually is hormonal in nature, and that's a different thing entirely. We're really talking about pain that typically is deeper in the pelvis, up in this part of the pelvis rather than down around the lower part of the pelvis. So what else can cause that? Well, intestines live there. They can cause pain sometimes, but it's usually not chronic pain, and usually there are other pretty obvious clues that it may be intestinal in nature. The urinary bladder lives right in here, right in front of the uterus, and the bladder can cause pain. Sometimes it is confused with these other things, but it's not uncommon actually that some of the venous issues cause discomfort in the bladder because there are veins around the bladder that are stretched. So it can be confusing. It does take some effort to sort these things out. But we're going to talk for a few minutes about the venous causes of pelvic pain. Imagine that these are legs, right leg, left leg. The venous blood going back to the heart flows through veins called femoral veins here into the pelvis, and in the pelvis this is called the external iliac vein. It is joined by veins coming out of the deep pelvis called internal iliac veins here, and then from here to here it's called the common iliac vein. These common iliac veins on both sides join at about the level of the navel right in front of the backbone, and the backbone behind them is one of the reasons that the veins can sometimes be compressed. Where they join, they pass on up in this large vein called the inferior vena cava back to the heart, which would be up here. The kidneys, the right kidney and the left kidney, drain into the inferior vena cava right here. There's a very large volume of blood that drains each kidney because the kidneys are filtering your blood continuously. Well, what we see causing pain down here in the pelvis and sometimes low back pain in this area is that veins have high pressure in them. With high pressure in the veins, they stretch. That stretching causes pain. Also, there is fluid, there are blood cells and a protein that weep through the wall of these veins under pressure into the tissues, causing an inflammatory reaction and pain too. So, if there's obstruction of this iliac vein coming up out of the pelvis, blood will be backed up in the leg. The most common cause of obstruction here is an artery in front of it. And if you look at this, imagine that we make a slice at the level of the navel across the patient, and then we look from the foot toward the head. If this is the backbone here, this is the right common iliac vein, left common iliac vein, and they're coming up to join like this into one vein. But the artery in front, which carries blood from the heart to the tissues, splits at that level. So the right common iliac artery here and the left common iliac artery here compress this left common iliac vein. So the vein is sandwiched between the artery and the backbone. And the artery has a lot of pressure in it. The backbone is not going to give, so the vein is what gets compressed. And so right in this area where the aorta comes down, it splits into two branches here, and they compress the iliac vein. So if this is so tight that not enough blood can get through here, then blood backs up under pressure in the leg and in the pelvis. It can cause leg pain and swelling. It can cause swelling and pain in the pelvis as well, sometimes both. Now, a lot of patients have some degree of compression there that's not really causing problems, and those should be left alone. There's another obstruction that we see in the pelvis, and that's compression of the renal vein. The kidney drains through what we call a renal vein here into the inferior vena cava, and compression there will cause blood to back up in the kidney. This is a view as if we're making a cross-section cut like we did before at the level of the left kidney, and this is the aorta, the big artery carrying blood to the tissues. This is the superior mesenteric artery here, which carries blood to the intestine, and the renal vein is caught in that notch between the two like a nutcracker. So this sometimes is called nutcracker syndrome if there is pain in the kidney associated with that. Now, some of these patients do have a lot of pain in the kidney up in the left flank. Others don't have pain in the kidney because there are enough other veins around here that carry blood around the blockage that it's not under such high pressure that there's pain here. One of the common ways that that blood gets around the blockage is to go backward in the ovarian vein. The left ovary lives here in the pelvis. Blood flow goes from the ovary up this way through a vein that really is normally only 2 or 3 millimeters in diameter, a little tiny vein, and drains the vein that drains the kidney here and then drains back in the inferior vena cava here. So if there is a blockage at this vein here, there's a lot of blood flow from the kidney that has to get back to the heart. It'll find a pathway, and the more common pathway that we see is that it goes down the ovarian vein, down this way into the pelvis, backward, and it creates a lot of varicose veins here in the pelvis. And often on x-ray when we inject dye in here, we'll see many varicose veins around the uterus going around the pelvis, and with blood flow going down this way and down across the pelvis and then back up these other veins here and here to get back to the heart. So if those are wide enough open and there's a good blood flow through them, it doesn't cause pain. But sometimes it will cause a lot of pain here in the pelvis. And so that's one of the things that we must sort out as we look at patients with chronic pelvic pain. Is it due to an obstruction here with blood backed up down here? Is it due to an obstruction here with blood passing down this way? And there are other causes. Occasionally, these veins in the pelvis have stretched so much, most commonly in women who've had a lot of children, that these veins are very enlarged, and when one sits or stands for prolonged periods of time, that blood just runs down by gravity, causing a heavy aching discomfort in the pelvis. There are a few where that's so bad that we need to do something about it to seal these veins shut, and we could do that through needle stick techniques in the neck or in the groin down here. Occasionally this left ovarian vein has reflux in it with totally normal renal vein, but when the patient sits or stands, blood runs backward down here, and it will cause, in some patients, enough swelling in the tissues here that there will be pain in the pelvis. And if so, we can also seal this vein shut with needle sticks in the groin down here, or through the neck, run a catheter down here, and then inject drugs and tiny little spring coils in this to seal it shut. So that's an easy way to deal with this if it's necessary. But in practice, what we find is the majority of the time chronic pelvic pain that is due to a venous cause is primarily due to an iliac vein obstruction here. And most of the time, if we treat this, even if there's a problem with this vein here, the patient's symptoms resolve or get improved enough that they don't need treatment for this problem. Occasionally, this renal vein compression or narrowing is so severe that something has to be done about it. It seems attractive to come up here and put a stent in it, much like the cardiologists do a stent in the heart, but the problem is some of the stents can migrate, some can break, some can form scar tissue in them, and so stents are not really considered the primary best way of treating this. Currently, the most favored approach is to disconnect this vein and move it down a little bit and get it out of that notch that I showed over here so that there's better blood flow. That's a big operation. And there's work going on to try to figure out how to design a stent that will work well up there, but that's not ready for prime time. What has been ready for prime time really for nearly 20 years is stenting the common iliac vein here. If indeed this is so tight that it's severely limiting blood flow out of the pelvis and out of the leg, causing symptoms that are seriously interfering with the patient's quality of life, and if this is the cause, then placing a stent that goes from here to hold this vein open is a very effective treatment for this. The key is making sure that you have the diagnosis right and that that's really the problem. And this is an outpatient procedure that typically goes quite well. Occasionally there's a stenosis or a narrowing of these veins along here from either an artery compressing the vein. And sometimes we see a lot of blockage, in fact sometimes total blockage of some of these veins from scar tissue from old clot. Occasionally we even treat patients who have total blockage of the veins from here all the way to here because of old clot, very extensive old clot. And some of the old clot stays there, creates scar. Some of it is about the consistency of a pencil eraser and just stays there with this rubbery sort of material inside the veins, obstructs them. The patients typically have a lot of swelling and pain in their legs. And in very severe cases, we will undertake getting a wire with x-ray guidance through this vein all the way up through here and across this, stretching the blockages with balloons, then putting stents in through large areas here. But the majority of patients who have a problem actually only need one stent for the one focal area where there's a problem. So it's key to be able to figure out if it's a venous problem, if it's something else. If it's a venous problem, then what exactly is it? Is it one lesion? Is it more than one lesion? What do you need to do? And it takes a lot of experience to do that. It also takes good equipment. Ultrasound is a real key way of evaluating this. High quality vascular ultrasound is essential to treat these and treat them well. Sometimes CT scans and MR scans with technique to look at the veins is helpful, but the ultrasound tells us about flow direction and flow velocity that we don't get from those other studies. So it's very, very helpful. It is important to be able to evaluate these. The average place that does ultrasound, even most of them that do vascular ultrasound, the average CT scan and the average MR scan will not tell you what you need to know for this. These are specialized imaging techniques, and they're generally not done adequately by those who are not deeply involved in treating this kind of patient, because the needs for the scanning and the interpretation are so different from that of the routine scan looking for other causes of problems. Well, thank you for listening. We'll put together some more brief talks to teach you a little bit more about these problems. And stay tuned, they will be coming soon.